initials are AW. She was submitted yesterday, May 1st. Her age is 76 years old, female, no known allergies. Height is 5'4", and she's 190 pounds. MD is young, team 8. Code status is full. Diet is MPO, no isolation, no AccuChecks. So, she's on Lovenox right now and morphine for the pain. And,
so she's on Lovenox?
Yeah, and then they're gonna do, or they've been doing TPA, and she's gonna be started on Coumadin eventually. I also gave her an antipyretic for her fever. So here's the story. She's diagnosed with pulmonary embolism. She has a history of DVT, obesity. She's a smoker for 10 years, smokes about 10 cigarettes a day. She had surgery on her hip because she had a hip fracture about a month ago. She also has AFib. So she had a chest x-ray which showed pleural effusion. She's on continuous ECG monitoring. Her D-dimer was elevated, 3,920, and they're going to do EBGs and a CTA and a venous ultrasound. She has a IV on her right, antecubital gauge 18. It was put in yesterday on the 1st. And then she also has one on her left wrist, and it's a 20 gauge. The one on her right arm has normal saline going 75 mLs per hour, and the tubing date was 5/1/16. So no redness, no swelling. Her last set of vital signs were 99.0 for the temperature, heart rate 95, respiratory 21, and her BP was 109/60. And she had a pain level of 5. She's on 4 liters of oxygen and the incentive spirometer's at the bed, and we've encouraged her to use it throughout the day. My plans for her were ineffective breathing, impaired gas exchange, and fear and anxiety. So,
Did she use the oxygen at home, or she
No. The reason why she's on the oxygen is because of the pulmonary embolism. So,
but
yeah.
she doesn't use oxygen at home?
No.
Okay.
No. So, anyways, okay, so her intake was, on my shift, the 12-hour shift, was 900 mLs, and she had an output of 400. So, her...
400 in 12 hours?
Yeah, so it's a positive balance. Anyway, so her mood was very anxious. She's super having a hard time with the, just the pain and not being able to breathe really well. So it's making her anxious. She's really restless. The family is at her bedside. She has 2 sons and a daughter. And then her husband passed away a few years ago. So the family's really worried about her and really concerned. They're also kind of anxious. It's kind of exacerbating her anxiety. So, I've tried to kind of calm the mood, but they're definitely worried. Anyway, she has the scar for the hip surgery. She's slightly cyanotic. It's gotten better since we've gotten her on the O2 and stuff, but she came in, a little bit blue lips. And
how's the capillary feel?
Yeah, it was kind of decreased when she first got here, but everything's better. So anyways, she's got her skin is dry, it's cool, no rashes or lesion, no jaundice. Turgor's okay. No pressure ulcers or edema. She's alert and oriented ×3. A negative Babinski, and grips were okay. No pronator drift. Fetal pushes are good. Her eyes were reactive to light and equal. No headache, blurred vision, numbness or tingling, nausea, vomiting. Her heart rhythm was, she goes back and forth between AFib and normal sinus. Mucous membranes were good, pink, moist, no JVD, already told me about the cap refill. She did have positive Homans though.
Oh, positive Homans.
On her right, yeah, they're gonna do the they already did the Doppler test, and so she does have DVT. Okay, pulses on her radial are 3 pedals plus 1. No AV shunt. She did have chest pain and palpitations and chest tightness. Definitely short of breath. On auscultating her lungs, there was crackles. At home, she had a cough and hemoptysis. Short of breath on rest. Abdomen soft, non-distended, and normal active. Last BM was 2 days ago. No nausea, diarrhea, or constipation. Her urination is clear and light yellow. No genital edema or anything, bladder distended, or any problems with, polyuria or nocturia. She's on bed rest, obviously, for the pulmonary embolism, so we're keeping her in a semi-Fowler position. And we're going to monitor her her PTT and her INR. Her labs all looked, as far as like her electrolytes and her hematology was all normal. The things that were elevated were platelets. 705. And then her chloride was 93, CO2 36, and then she had the increased D-dimer, which I told you about, and increased troponin and BNP. And just we're going to continue to monitor the PTT, which that was 20, and then her INR is high. Okay, so anyways, I'll give you a little bit. She just came into the ED with shortness of breath, tachypnea, cough, chest pain, hemoptysis, and she syncopated at home and had a change in mental status and very anxious. Her daughter found her on the floor in the bathroom, so they brought her into the emergency room, and then, that's where she was, they found fever, and she's hypoxic, fast heart rate, rapid breathing, and crackles in her lungs. So, as of now, we're just anticoagulating her, and then I'm waiting to hear back from the doctor about if he wants to do an inferior vena cava filter surgery. So, I already told him that the patient was waiting to hear back about that, so we're just waiting to hear from him. So yeah, that's about it. Okay,
that sounds good. So, any new orders?
No new orders except, the ones I had already told you about.
Okay.
And I last medicated her for the morphine about 2 hours ago, so.
How was the pain when you...
It was like 8, she said, so, and yeah, she said 7 or 8.
7 or 8? Okay, so we're just gonna...
And now it's lowered, but...
Alright, so we're just gonna continue monitoring the pain, and then maybe, during the whole shift, and just documenting that, that's it.
Okay.